Convulsions, confusion, staring, even behavioral changes, they all can be signs of a seizure. But what's happening inside the brain to make it misfire? You'll hear from the experts on today's All Things Brain Health, along with a patient who's finally living seizure-free. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. A 19-year-old who's now 21 finally found relief from terrible seizures with just one surgery. Tony Wild spent years suffering until he had temporal lobe resection. This picture is his brain before and after, and you see that dark spot in the right image on the right-hand side of your screen? That's the small part of Tony's brain where his seizures were originating. We want to warn you, today we will be showing some graphic medical images during the program of Tony's brain. We'll try to give you a nice heads up before those moments. And joining me in the studio today is Tony Wild. Tony, thank you for being here.
It's a pleasure.
Saw the picture of you in your tux, but you have a whole new look now, and I love it.
I'm kind of going back to how I dressed in junior high.
Back to your roots?
Yeah.
We got to give you a hats off because Tony told us when he showed up in the studio today, not only did he work the overnight shift, but he came in from Joplin.
Thank you.
What a doll. Thank you, Tony. Tony is here. He underwent the brain surgery that curbed his seizures, and we have his epileptologist, Dr. Carol Ulloa. Thank you for being here.
Good morning.
And we have his neurosurgeon beside me, Dr. Jennifer Cheng. Thank you. Tony, I want to start with the epilepsy. How did it affect your daily things when you were having your seizures?
It takes away your ability to drive, and it really takes a lot of the fun out of just being a teenager. It's like,
I bet.
You can't get your permit, you can't drive, you can't go hang out with friends really.
And now you're able to drive. You drove here from Joplin and worked your full shift.
Yeah.
Overnight at McDonald's.
It's like getting your life back really.
Right. How long do you remember you were suffering those?
Start of high school to the end of high school.
And that's a terrible time to not have your independence, because that's when you're like starting to want to spread your wings.
Yeah.
You told me when we talked on the phone about a really alarming experience. It was kind of like the final straw where you had a seizure at your mailbox.
Yeah, that's when I started going to the doctors.
And what happened? Who found you?
Just some random person. They're like, oh.
And how, you had a seizure going out to get your mail, and someone driving by found you on the ground?
Yeah, I was just walking to get the mail one day, and I got that funny feeling. And next thing I know, I'm in a hospital, and somebody's like, yeah, somebody found you in a ditch at the side of the road. And it's like, oh.
Oh my gosh, that's terrifying. The funny feeling would be one of your auras, right?
Yep.
I want to bring in your doctors. Dr. Ulloa, for people without medical backgrounds, where's the temporal lobe located?
The temporal lobe is kind of low on the head, so it's at the base of the brain. If you think kind of above your ears, and kind of starts in the temple area and then goes back, so it's lower on the head. And
what is that part of the brain that's most in charge of things that would deal with your seizures and your ability to get through your day? Would that be in the temporal lobe?
So the main two functions of the temporal lobes are language and memory. And all of us have a dominant side. For most, it's the left side. Some people actually have the right side dominant or kind of shared. And so the dominant side is where language lives and more of the memory.
And what made Tony a strong candidate, Dr. Cheng, for a temporal lobe resection?
So for Tony, we had shown through multiple prior tests that we had kind of locked it down that the seizures came from that area in his temporal lobe. And for him, it was on his right side. So it was his non-dominant side, which was also a positive factor because it would mean that there would not be risk to language. from doing that surgery.
And then at what point in Tony's journey did you meet him for the first time?
Before the stereo EEG.
After all the testing, before the stereo
Yes,
EEG.
right.
Yes.
Like how many years have you known, you three known each other?
It's only been, so when I met you the first time was February of 24.
Okay.
And right away, I mean, his neurologist that referred him very specifically was for drug-resistant epilepsies. So from the first time I met you, we discussed that and we started the journey of the testing. So, you know, so from like meeting to first surgery, you know, was less than a year. Yeah.
But you developed a pretty nice bond with your two doctors, because when they first told me about you, they said, you have to meet this patient. He's a doll. He's so sweet. He's thoughtful. They really sang your praises. Did you feel that connection when you first met them? Don't mind the drilling above us. We're having some construction. Did you feel that bond?
Yeah. Most other doctors, it's like, oh, I have to go. But coming up here, it's like, oh, I get to see them again.
It's sweet. From a guy driving from Joplin. It's rare that someone looks forward to those drives. But you also insisted on being here in person.
Yeah.
Which we love. Another question for you, Dr. Cheng. Before you operate on a patient, particularly a younger patient, what are the main things that you want to make sure they're aware of?
So it's a pretty long, involved, like office conversation or multiple conversations, and we really want to make sure that we're all on the same page as to like, well, what are the goals? You know, why are we doing this? Or what is this for? You know, how is this going to help you, you know, achieve your goal? Like, if you want to stop your seizure, you know, improve your quality of life. Like, how are we doing that? And so they really, I want them to understand the reasoning of the surgery, and then also, you know, what's the chance of success, and what are some of the risks? Because, you know, every surgery we do, there are some surgical risks, and we have to hopefully make sure that this person is understanding what they're going into, what they're signing up for. So it's a pretty long conversation about that.
Tony, what were your concerns or biggest questions?
Mainly what the risks were. I already knew about the advantages after getting the surgery done.
Sure, you didn't want to
Freedom.
freedom to be yourself and do things. We have some really cool images that were shared with us. Dr. Cheng, what are we looking at here?
So this is it's a computer simulation of Tony's brain, and then where you see the red, those are electrodes. So those are actually thin wires that we implanted into his brain. So this was it was a surgery, but it was for diagnostic purpose. It wasn't to treat the seizures, it was to determine more fully where the seizures come from.
This wasn't the big surgery.
Right.
Okay.
This was we put the wires into the brain so that we could record when he had seizures, where exactly the seizures started and how did the seizures evolve. And so that was done to confirm that location in the right temporal lobe.
How do you insert those probes?
Yeah,
Electrodes?
so we have a surgery that we do with actually a robotic assistant during surgery. The robot doesn't insert the probes, like we insert the probes, but the robot helps us be very precise in how we position those in space. So we have the patient's head, and the robot arm drives very precisely to the correct location and gets into the correct angle, and then through the robot arm we will drill a very small hole, like a tiny hole, and then place what's called a bolt, and then place the electrode into the brain.
That was my next question, is how you get in there. So, Tony, what do you remember about waking up from that procedure?
It hurt.
Kind of achy?
Yeah, just thinking about it gives me a headache.
Gives you kind of the willies. Well, we have some other pictures to show our viewers. Now, these are the ones we want to tell our viewers, if you're squeamish, you can close your eyes right now. We'll let you know when it's all clear. For those of you who are curious, though, these pictures are incredible. Let's take a look at Tony's brain. This is a picture taken during the big surgery. Dr. Cheng, where is this on Tony's head?
Okay, so we did a surgery for Tony's right temporal lobe, which would mean that this is sort of right above his right ear.
Okay.
Okay.
And we have another closer look that we want to pull up in the monitor behind us, because I'd love for you to point to the image that pops up when it pops up behind us and explain what this is.
Okay, so this is a picture of the temporal lobe specimen that we took out. So this is, this chunk of tissue is at the anterior of his temporal lobe, and that's the A is just anterior, and this just shows kind of like the measurement that we took of this. But this is kind of the outer surface of the temporal lobe that we removed as part of the surgery. Deeper down, the hippocampus, which is in his deep temporal lobe, was the structure that was causing the seizure. So we had to first remove this outer portion so that we could reach that area.
So that's not the part where the seizures were coming from, that's the part you had to remove to get to it?
Right, yes.
Tony, what's it like seeing that?
Gross.
That's honest. It's kind of fascinating. So how big was that, about 2 inches?
Yeah, about.
So how big then was the part in the hippocampus that you had to remove, where his seizures were originating?
So the hippocampus is a little bit of a smaller structure, and we tried to remove the hippocampus as fully as we can, up until the very posterior, the tail of it, we remove. So that part, it's deeper, and we have to use a microscope to sort of take it out.
Okay,
Yeah.
oh, it's fascinating. I wanted to ask Dr. Ulloa a question. When it comes to patients that you consider as options to work with Dr. Cheng on and have her do the surgery, how does Tony's age compare to other patients that you've referred for the surgery?
Oh, yes, that's a great question. I will say this, the younger the better.
Okay.
So this is an ideal situation, started as a teenager and, ended up with surgery at 19. But we do the whole gamut. I mean, as old as in their 70s.
But the younger the better.
The younger the better.
To our squeamish viewers, by the way, it's safe to open your eyes now. No more brain pictures. We didn't give you that warning, Tony, because we showed you right when you arrived. We're going to be looking at your brain. See how you feel about that. What were your biggest concerns going into the big surgery?
The risk.
Still the risk.
Yeah, if I can't move my arms or my legs, I can't see. I don't know.
So, sometimes during brain surgeries, patients are kept awake. Is this that kind of surgery?
For this particular surgery, we did not do it with Tony awake. We had him asleep under anesthesia. But there are some surgeries where we have a patient who is sedated, so sleeping for the most part, but we wake them up during certain portions of the surgery to test certain functions. It's typically language that we need to test with a patient awake.
Well, we've seen those videos on YouTube, and I think I've asked you about this before, where you'll see a person undergoing brain surgery, but they're playing the violin or singing or talking to people, and that's wild to see that.
Yeah,
Pardon the pun, Tony Wild. But it is. We do have some great questions and comments coming in, so I want to make sure if you have a question or a comment that you get those answered this morning, or we can read it out loud in the program. Just send it to us on YouTube, Facebook. You'll find the links right there on your screen. Tony, it's only been a year since your surgery. When did you notice the change?
What kind of change?
Like, oh my gosh, I have no more seizures. How soon did you feel like you could relax?
Probably when I got my hands behind the steering wheel, just drive around.
Yeah.
Go to the store, pick up groceries. It's like,
there you are.
there it is.
And you're right. It must feel pretty good. You'll never complain about driving then, anywhere.
I love driving.
You're the guy that will pick people up from the airport when they arrive in town?
Yeah.
Because no one likes to do that, but you probably love it.
I had to pick up my sister for Christmas.
I'll do it.
That was a 4-hour drive.
And you didn't mind?
Nope.
Because you got your independence back. What are you most looking forward to now that you have all these years ahead of you with your independence?
I don't know, just explore the world.
Yeah, just get out there.
Yeah.
Explore the country on the open road. Dr. Ulloa, how common is it for patients that you have to be seizure-free when they come back to you after just one surgery?
So with this temporal lobe epilepsy, the same type of condition that Tony had, it's basically about a 75% chance of seizure freedom after surgery.
And what would happen if you had a patient where they weren't seizure-free? Can you have another surgery?
Right, so if there was a person who was not seizure-free, we may need to do a little bit of workup again to sort of just try to determine why that is. I would say the most common reason for this surgery is that there could be a small piece of hippocampus left, or the seizure area that could be left, and we may need to do another surgery, yes, to remove that.
What's it like to see a patient like Tony, who's looking so awesome and is so happy?
It's super rewarding. It's kind of why I love this job. I mean, it's amazing.
It's why you do what you do. Dr. Ulloa, can you talk to us a little bit about the Epilepsy Brain Bank?
Oh, yes. Gosh, I established that at this point like 5 years ago, and it's basically a frozen brain bank of the tissue that's removed from patients' brains for when they have epilepsy surgery. So a part of the brain has to go to pathology to study it under the microscope, get a better idea of why the person has epilepsy. But there's tissue that's in excess, and it would just go in the trash. So this, actually, they prepare it, they freeze it, and it is available for researchers to then do studies, so we can learn more about treatments for epilepsy and really other neurologic disorders.
And you started this here.
I did, yes.
We need to toot Dr. Ulloa's horn because she won't toot it for us.
Well,
you are incredible. You're the top epileptologist in the entire region. And you created this brain bank. Why was that so important to you?
Okay, you're tooting too much.
You can't contradict
So let me rewind a little bit.
Yeah.
I want to toot somebody else's horn, and that's
Yeah.
Dr. Wong, Incha Wong, who is a neurologist here. And she served as a mentor to me, and it was really her advising me and saying, hey, all these surgeries you're doing, what are you doing with that tissue?
Right.
I'm like, well, we're throwing it in the trash. And she said, well,
Can't do anything.
maybe, yeah, maybe you need to start this, because it's a, for researchers who need it, it's not every day you come around brain tissue,
And
human brain tissue.
Right. Well, I know this because we donated my dad's brain after he passed, because he had
Yes.
Alzheimer's, and it was so important to go to the brain bank at the Alzheimer's Disease Research Center. So I love that you made that decision. Why was it important to you to say, yep, take that piece of my brain and let's study it?
They wouldn't let me keep it in a jar.
Yes,
so
that's what you wanted.
I figured that if somebody can benefit from learning about a little piece of my brain, I feel like that had some importance, just to go ahead and donate it.
And where is the brain bank physically? Where are the parts of the brain?
It's a building in one of the university buildings here on campus, and it's a freezer that's like negative 170 degrees Celsius.
And Dr. Cheng, from your perspective, how crucial is this kind of collaboration for your research as well?
Yeah, it's really important. This is an exciting time because there are a lot of advances being made in treatments of neurologic diseases, including epilepsy, which is why it's been great for us. But I think that the basic science research, having that access to human brain specimens is going to be crucial for developing new treatments.
Are there ever any other health systems or hospitals that ask to see the brains as well for their own research, or do they stay here at the health system at the med center?
So mostly it would be collaboration here, but yes, it is open to other people around the country.
That's so neat. I want to get to some of our community questions and the comments that we have coming in from our viewers. Jeremy Yenser has a great question. He wants to know, how do you know that a section of brain is okay to remove like that? Or was it more that the potential benefit was just much better than the damage that area was causing? So how do you figure out how big of a section you want to remove?
Well, so for the temporal lobe, we know that from past experience, long past experience of how much can be safely removed, and it's different for the dominant side, the language side, and the non-dominant side. So for the right or non-dominant side, which is this case, we could go a little bit farther, but for the language side, we have to take lesser. So. But then speaking of, I think what they were also saying was like, are the risks worth the benefits? We did mention that the temporal lobe is involved in memory as well. So if we do this surgery, We could be damaging the person's short-term memory somewhat. You know, it should not be. It would not be considered severe. It wouldn't be like the person is completely amnestic. But you know, whereas before the brain had both sides to form memories, after the surgery, Tony's brain has one side, his left side, to form the memories.
Okay.
So there is that potential, like, slight, you know, decrease in short-term memory. But then we were weighing that against, okay, but everything else, like trying to stop the seizures. So
Right.
that was also a choice that Tony made, that he was willing to face that.
Give you your life back.
Yeah.
Did you have any short-term memory things that you noticed, or any things you noticed that were just a little different as you recovered?
My memory was worse before I had the surgery,
Okay.
and having to be better after, that's also a benefit.
Is that common?
Yeah, so that can happen because often people with epilepsy, their memory is not normal because of the seizures.
Right.
So by stopping the seizures, you are preventing further impact on the memory from the seizure. So yes, that in a proportion of patients with this type of surgery, you'll actually see an improvement.
Becca has another question, and I'll direct this one, well, to either doctor, because Becca had a follow-up question. You said the younger the better for these surgeries. Why is that? Who wants to take that one?
Oh, I think both. I think the simple way I'd say it is you've had less years of impact from the ongoing seizures. So we just got through talking about memory. So there's, they've had less time to kind of cause issues in the brain. Sometimes when people have seizures from one temporal lobe, the other temporal lobe decides to start getting into the mix and also develop seizures. So the less time you have it, kind of the less effect you can have, and thereby, you know, earlier surgery is going to be more beneficial. But also, younger in general, surgeries are easier on younger people, you know.
You just bounce
They're
back.
stronger. Exactly. Yes, exactly.
That's pretty much for anything, injuries, the whole 9 yards. Patty wants to know, Tony, this is for you. What would you say to other young people who are hesitant or worried about having a surgery like this?
Time goes by a lot faster than you think, and if you just kind of sit in fear of like, oh, I don't want to get it done, it'll negatively impact your life.
That anxiety.
Yeah, and you'll heal way faster than you think.
How was your recovery?
You know, it was like a long headache, head sticking to the pillow.
Head sticking to the
stitches.
pillow because of
Yeah.
stitches and stuff?
Yeah.
Did they have to shave all your beautiful hair off?
Yeah, that's one thing about my hair. It's like after you've like had your head shaved, you
Yeah.
know, it's like it makes you not want to get your hair cut.
Right.
So I'm growing my hair out.
You wear it well. And I see some highlights in it. You got some red in there.
My friend did that.
She, they're very talented.
Yeah.
How long are you going to grow your hair?
I have no idea.
Just keep it going. It's nice and shiny and healthy. We've talked about a little bit about the risks of the surgery. Marie wants to know, are there any patients who are absolutely not candidates for this kind of surgery?
So there are some people that would be less likely to be a candidate. If someone has like very significant medical problems that, you know, there could be someone who's not safe to undergo anesthesia. Then when we just talk about epilepsy surgery in general, Dr. Joe was mentioning, you know, sometimes people can have epilepsy from both temporal lobes. So, and that can be a sort of a different, more tricky situation where we might choose to do something else up front. We usually might use a device that we implant to try to control the seizures, unless we can really determine that truly it's the one temporal lobe that is the very significant problem, and then the other one is not much of a problem, because otherwise, you know, you wouldn't want to go after a temporal lobe.
John wants to know, Tony, how many different medications did you try? Dr. Ulloa said it was medication-resistant epilepsy.
Yes.
How long and how many?
I was first on Keppra, and it like sucked all the energy out of me. Like I couldn't really do anything throughout the whole day.
Yeah, so you didn't have seizures, but also you didn't have any energy.
I still had seizures even on the medication.
Oh, that's a bummer. How common is that?
Yeah, and then two other ones. When I met you, you were on 2 medicines. So we can say that drug-resistant epilepsy is once you have failed 2 medicines and are still having seizures. And that's because then we know the chances of the 3rd, the 4th, the 5th stopping the seizures really drops significantly to 5% and further down from there. And it's about 1 out of 3 people with epilepsy, so it's common.
1 out of 3 have drug resistant?
Yes.
Wow. Jesse writes, do patients often choose to participate in tissue donation, or do you have to kind of coax them into it?
People really are, I would say, totally into it.
I bet.
Yes.
It's so important.
It's extremely rare that they say, no, throw it in the trash.
That doesn't sound good. You want your body to be useful.
Yes.
Beth wants to know, is this surgery ever a first choice, or is this a final option in treatments?
Well, the good thing is that there are multiple options, and that's part of the reason, I mentioned this long office discussion where we're just discussing the surgery, but we're also offering various options to the patient. For example, there is a laser surgery which is a little bit more minimally invasive, where we use a laser to heat and destroy the hippocampus. But that being more minimally invasive is a little bit easier to recover from, but the seizure freedom rate is a little bit lesser. So it's about 55% chance of being seizure-free versus the temporal lobectomy, 70-75% chance of being seizure-free. And there's also like the devices that I mentioned that we could use to implant to control the seizures. Those would be maybe appropriate for someone who very much does not want their brain tissue removed or damaged. So we could try to control the seizures first with a device, which doesn't have as high seizure freedom rate, but it can decrease seizures significantly.
So there are other options?
Yes, there are other options.
Judith wants to know, Dr. Ulloa, is it possible for someone to outgrow seizures?
It is, yes, certainly. And a lot of those syndromes are genetic and begin in childhood. And so by understanding the history, what the seizures are like, when did they start, you can gather whether it's something they might outgrow.
Ashley has a question about triggers. Tony, what were your triggers?
Stress, like real heavy stress.
And how long would you be under stress before you'd start to feel the aura?
It was just more of a build-up.
Okay. So like that day you went out to the mailbox, you were probably under some stress.
Yeah, just like, I just need to get some fresh air.
Right. What did the aura feel like? What were your auras like?
Like real heavy deja vu. Like, I've been here before. Yeah.
And then how soon after you have that deja vu would you have a seizure?
Within like 20 minutes, I'd say.
Gosh. And if you're doing anything, you just need to know you have to get to a safe place.
Yeah.
We have one more quick question. John wants to know, what's the largest section of brain you've ever removed or could remove? It's kind of an interesting one.
That is interesting. I would just say that there is a particular surgery, most often that is performed in pediatric patients, which is called hemispherectomy. And that is appropriate for some patients as a treatment of epilepsy, where the patient has significant damage on one whole side of the brain. And so one of the treatments that has been done has been removing that hemisphere.
A whole chunk of the brain.
Right. So that's in pediatric patients mostly. It's very little applied for adult epilepsy.
So interesting. As we wrap up this discussion, I'd love to get today's takeaways. Tony, I want to start with you. It was important to you to be on this program and share your experience. What did you most want viewers to know?
Basically, that just to tell a little bit of my story, show a little bit about the people who can help you. Mm-hmm. I was real afraid of just like actually going out and being like, oh, I don't want to go to the doctor. It's expensive, but like there are programs that you can use to get help.
And you did.
Yeah.
Dr. Cheng, what would you like our viewers to know?
Yeah, I just think that first of all, it's just so nice of Tony to be here, so I'm really happy that he was able to share his story. I just think that it's just good education for people who have epilepsy, or if you have a friend or family member that has epilepsy, that should see a neurologist. If that epilepsy is not controlled with 2 or more medications, they should be referred to a larger center. So I
And
think
there's
that's
help.
really important things for people to know.
Dr. Ulloa, what's it like to be sitting here next to Tony and see him doing amazing?
It's the best. I mean, literally, it's the best. This is why we do this work, you know, why I enjoy it, why I chose to do it to begin with. It's one of the diseases in neurology that you can make such a big impact on and really change someone's life. So it's wonderful. I can't wait to see what he does in the future.
Tony, do you promise to keep us updated? I want pictures also of your hair updates. I want to see how long it gets. All right?
I think about doing a split dye. One side red, one side black.
Okay, well then we need pictures. We need pictures of that for sure. Thank you for being here and sharing your journey. Doctors, thank you for taking the time out of your days. We're so lucky to have you both here at the health system. And thank you to our viewers for joining the conversation. Coming up tomorrow, we have new hope to cystic fibrosis patients that science had left behind. Details of the new research tomorrow at 8 a.m.